Well, hello. This is Dr. Chris Gubbels here from Square One, and we are here with your live at 5 here on Wednesday, the 27th. And today we are going to be talking about what causes scoliosis. It's probably one of the most common things that I'm asked by patients that actually find out they have scoliosis is they want to know what actually causes this. There's different beliefs, there's some myths, and some people have an idea, but today I hope to clear up a lot of that, and I'm going to be going over several of the different potential causes of scoliosis. So if you do have questions, just put those comments below. I'll do my best to answer those. And I hope you find this information helpful, and maybe it'll give you some answers that you or someone you know has been looking for. So without further ado, let's get started on what causes scoliosis. Now, the most common cause of scoliosis is what we call idiopathic scoliosis. And idiopathic basically means we do not know the actual cause. It's an unknown cause. 80% of all scoliosis are actually idiopathic. Now, idiopathic scoliosis develop during years when we're growing. They most commonly develop during adolescence or when teenagers are going through growth spurts. But an idiopathic scoliosis can also develop during infancy or during childhood. So anytime up to the point where someone reaches skeletal maturity is when an idiopathic scoliosis can actually develop. And like I said, this is the most common type of scoliosis. It's the one we most frequently think of. It's the one that's was always being checked by nurses or whenever we did scoliosis screenings. And like I said, 80% of all cases are an idiopathic scoliosis. But what about those 20% that are not? What about the other potential causes of scoliosis? Now, congenital scoliosis it's a pretty well-known cause, and congenital means that the spine actually grew with a deformity. And the two most common types of deformities are, one, when you have what's called a hemivertebrae, where a vertebrae form misshaped, or you have like an extra vertebrae, typically forming like a wedge, like you see here in the middle of the picture, or having several fused or wedged vertebrae, like on the right, or blocked vertebrae, and that typically can cause the spine to bend or curve. Now, when these become more severe, these are most commonly treated with surgery. That is the treatment of choice for more severe scoliosis caused by a congenital malformation. This is actually an X-ray, and an X-ray where a severe scoliosis developed as a result of a hemivertebrae. You can see the line pointing to that hemivertebrae or that misshaped vertebrae. Now, neurological, and I'm going to go through several different potential neurological causes of scoliosis. One of the most typical neurological scoliosis is a scoliosis caused by cerebral palsy. And cerebral palsy is basically when there is a developmental problem with the brain that happens during the development during pregnancy. And basically, when someone has cerebral palsy, and there can be different severities of that, but a lot of times people have a hard time holding and supporting themselves and being able to maintain an upright position. And so over time, if they cannot maintain an upright position, their spine tends to collapse and give in. And over time, when the spine collapses, that puts uneven stresses and pressures on the spine itself, which over time can break down, lead to degeneration. But basically, the spine can't collapse. A lot of times these people that have a cerebral palsy related scoliosis end up having spinal fusion, but there also is some non-surgical treatment options, and there's something called the suspension brace, and we've done some of these in our clinic where the brace can actually push down in a wheelchair and lift up and support the body to literally suspend them to keep them from collapsing. And the goal of that is to keep the scoliosis from deformity from growing and getting more severe over time. Muscular dystrophy, probably the most common is Duchenne's muscular dystrophy. This is a neurological condition where basically the neuromuscular tissue starts to wear or degenerate over time, and there can be different severities of this. And based on the level of severity, that's going to impact the level of the severity that it will impact the person. It also can affect the likelihood of a scoliosis developing. But in a similar fashion, when the musculature or the neuromuscular ability to maintain an erect position starts to degrade over time, a spine can collapse, like you see in the picture in the scoliosis. And over time, that collapsing can lead to the development of a deformity or a scoliotic deformity. Spina bifida. Now, there's different levels or severity of spina bifida. And when a lot of people think of spina bifida, they think of spina bifida occulta. And that's basically what a spina bifida is when there's a failure of the spinal cord to completely fuse, or a union of the vertebral body to form that encapsulation around the spinal cord. Now, with a spinal bifida occulta, a lot of times these people don't even know they have it until maybe it's pointed out getting some kind of routine x-ray. Maybe they get an x-ray for back pain, and a lot of times it doesn't actually affect them. The next level up, or more severe, is a meningocelia, which is basically when the surrounding of the spinal cord actually, or like the meninges or the encasement of the spinal cord actually starts to break through the opening or the non-union of the vertebral bones. And you can see how it forms a cyst. And then the most severe form of a spina bifida is a myelomeningeal spina bifida. And in that case, it's actually the neuro tissue actually starts to fill in the cyst. And these are the ones that are most frequently associated with the scoliosis that develops secondarily to a spina bifida. All right. And then we're going to link these two together. You can have laryngomyelia, which is basically also known as a syrinx. So if you look at the picture on the right, this is an MRI, a T2 weighted MRI, where you can actually see fluid building up in the spinal cord. So over here, you can see these are the vertebrae. Then you can see this tube here in the middle. And in that tube, you can see the white matter. And that's fluid building up, or a fluid-filled cyst building up in the spinal cord. Now, that can expand over time. And if that gets severe enough, then a decompression surgery is needed to relieve the pressure along the spinal cord. The other one I want to talk about is an Arnold-Chiari malformation. We're talking about a type 1 Arnold-Chiari malformation. And basically what an Arnold-Chiari malformation is when the cerebellar tonsils, which is right here at the base of the skull, when it extends down beyond the foramen magnum, or the opening of the cranium. And a lot of times, additionally, like a decompression surgery is needed, but these can lead to a neurological scoliosis. Then let's move on to a neurofibromatosis type 1 scoliosis. And this is classically identified by these brown spots you see on the body called cafe au lait spots. And that's a classical sign of this. So neurofibromatosis is a genetic condition, and there's different severities of that, but it can cause both tumors throughout the body and neuromas throughout the body, and it can cause tumors and neuromas around both the spinal cord, spinal nerves, and also around the spine itself. Now, there's a couple different types of scoliosis that can develop from neurofibromatosis. The less severe really acts very similar to an idiopathic scoliosis, but the more severe form, where you actually get tumors or you get neuromas that develop in the spinal cord and cause bony deformity within the spine itself, that can lead to more severe forms, which a lot of times end up leading to surgeries. But again, the classic identification is the brown spots on the body. So you always have to physically look at the body. And then we have what's called syndromic or mesenchymal. And the two I'm going to talk about are Marfan's and Ehlers-Danlos syndrome. And these are basically the genetic conditions, and they are connective tissue disorders. And what happens is when you have a change in the connective tissue, in the elasticity the body doesn't have the ability to support itself. So think about connective tissues hold the body together. They can help support the spine, and when these get weak or they get very lax, the body can get to a point where it cannot support itself naturally, and eventually over time, the body can collapse, causing a scoliosis. This picture here on the right is actually a patient that has Marfan syndrome. And some classic signs of Marfan syndrome are one, when you have really long fingernails, that can be a sign, like really excessive long fingernails. When people have appendages like their arm span is longer than their overall height. You can do some flexibility tests where someone takes their thumb, you can't see it on me, but their thumb will actually extend past the other side, or when someone can take their hands and connect them and they will reach or go overextend when you're surrounding your list. Ultimately, that's detected though with an actual DNA or genetic testing. One I don't have a slide on I want to talk about is a scoliosis secondary to a trauma. So someone could have a trauma, whether a fall, maybe a severe car crash, something like that, that could actually damage the spine itself, or it could cause neurological damage, and that can lead to a scoliosis developing as well. And then we have scoliosis related to degeneration, or a de novo scoliosis. So de novo scoliosis is a new scoliosis that develops in adulthood. And so you can have a degeneration of a scoliosis that is basically a de novo scoliosis, or you could have someone that had an idiopathic scoliosis when they're younger that breaks down and degenerates. And basically, in a degenerative scoliosis, the gravity is pushing down. And when gravity pushes down, you get some asymmetries, or maybe the posture collapses. And typically what happens is you'll have the disc on one side that starts to break down, and then you'll have like a facet or part of the joints in the back on one side that starts to break down. And then it starts to rotate. Then with more pressure with gravity, you get bigger uneven pressures, and then the one side of the spine continues to break down, decay over time, and that's when that tends to progress. About 70 to 80% of all of the scoliosis we see in our office are a degenerative scoliosis. It's a scoliosis that, and some of the patients were never detected with scoliosis, so they may have had a scoliosis that actually developed in adulthood, and some are people that had scoliosis when they were younger that did or did not have treatment. But a lot of times these curves progress and they get more severe, they get more painful, they get more problematic in adulthood compared to when they were adolescents. And so that's when a lot of people are seeking treatments. 38% of adults over 60 have scoliosis. A lot of those are degenerative. 50% of adults over 90 have scoliosis. 10% of adults over 40 have scoliosis. But when we look at adolescents, it's only probably 2 to 4% of the population. So on average, about 3% of the population is believed to have scoliosis. And of that 3%, probably only 10% of those actually require treatment. So you can see the numbers progress as we get older. So a lot of potential different causes of scoliosis, and there's others I didn't really dive into. And the reason this is important, when someone's treating scoliosis, if you're going to treat a scoliosis case, you are basically taking on the responsibility to rule out all possible causes of scoliosis and things that become because of a bigger issue, like a spinal cord tumor or a cyst or Chiari malformation, or Arnold-Chiari malformation. So if you have scoliosis, or you know someone that's maybe suffering from these, or you see people that have some issues, and you're looking for help, don't hesitate to reach out to our office. That's our phone number, 207-4463. That's our website. And if you do have questions, just put those comments below and I will do my best to answer. And then if you know someone that's suffering from these things, just share the video and let them know about our office, because, we may be a solution for someone in need. But again, Dr. Chris Gubbels here. Thank you for attending our Wednesday live at 5. And I hope that someone here found this helpful.